So let's study some important topics for Neet PG exam. Plasma osmolality mainly contributed by sodium. The equation is 2Na plus glucose by 180 plus BUN by 2.8. Ionotropic and metabotropic. So ionotropic, I comes, you can remember the mnemonic BIN. GABA B, I for ionotropic, then N for nicotinic, whereas GABA A and C and muscarinic are metabotropic. Next is minimal access surgery, the other name for laparoscopic surgery. Focus group discussion, it's actually a 6 to 12 member group, but there will be a leader. Learned behavior, established behavior. So here learned behavior is actually culture, established is custom. If it's difficult to remember, easy way is both are CU. The next letter can be L, then learned behavior. If it is established, S, custom. Denominator in incidence. So incidence, it's a new case. So divided by population at risk. So it's a variance of that is attack rate and secondary attack rate, and I hope you know that in secondary attack rate the denominator will be like the population. Again it is who are susceptible among the contacts. It's not in the community, it's saying about the close contacts. That is secondary attack rate. So whoever can get the disease from first case, the primary case, whoever can get the disease and they are susceptible to that among that close contacts, whoever they are contacted with this person, that is incidence. That is secondary attack rate. They are the two variants, attack rate and secondary attack rate, two variants of incidence. Regarding prevalence, it's a total existing case. So that case, it can be in a period of time or a point of time. Point prevalence and period prevalence. Then normal distribution curve, mean, median and mode. So you have to remember the mean equal to median equal to mode. Median is equal to 0. And what about the ST and variance equal to 1. For a plot, they are plotting meta-analysis. Family cycle is formation, extension. Then you have complete extension, contraction, complete contraction, dissolution. So it is like first marriage, then first child, then second child. Then first child will leave the home. Then the second child leave the home. First spouse die, second spouse die. So formation, that means marriage occur. Extension, first child. Complete extension, second child also. Contraction, first child went. Complete contraction, second child also. So dissolution, first spouse die to the second spouse die. Then next is septic tank. So you have to know it is accommodating 500 gallons. Length is twice the breadth and the depth is around 2 meters. So L is equal to 2B and the depth is also 2 meter. 2, easy to remember. So 2 plus 2 is 4 plus 1 5, that is 500 gallons capacity. Inside anaerobic action takes place. Delphi method is actually forecasting. Consensus. Then atracurium and mivacurium. Atracurium, Hoffman's elimination. Mivacurium, plasma cholinesterase. Then next is beta blocker with potassium blocker action sotalol, whereas beta blocker with sodium channel blocker propranolol. So progesterone receptor blocker mifepristone and ulipristal, whereas estrogen receptor blocker clomiphene and centchromin. Liraglutide and teduglutide. One is lira, remember lonely. So 1, GLP-1 analog, teduglutide is GLP-2, T for 2. Acetazolamide is inhibiting carbonic anhydrase enzyme. So H2CO3 is increased in our blood, metabolic acidosis. Whereas what happens to the urine? So acetazolamide causes metabolic acidosis and alkalization of urine. Now, Parkinsonism, which drug is given as transdermal patch? Rotigotin. Target bladder. So in overactive bladder management, which drug target bladder? That is, we are adjusting the dose in renal failure, that is trospium. Mnemonic T for T, target, trospium. Magnesium toxicity, loss of patellar reflex 10 to 12 milliequivalents per liter. What happens in adiposia formation? There will be saponification, so the facial features becomes more prominent. Spectroscopic test is done for blood. Spectroscopic, RBC. Mandible is obtuse for infant and elderly, whereas it's acute for adult. So this obtuse, how can you identify this age? Look at the mandibular foramen. In children it is below, middle in adult, above, near to alveolus in elderly. Whitnall's tubercle, it is in lateral. Ponderal index is actually gram per centimeter cube. Zinc is decreasing cell mediated immunity. Ectopic ureter in females, it is into the labia majora, whereas in males to the prostatic ureter. Radial nerve, prostatic urethra. Radial nerve injury, remember, if it is above the elbow, that is at the lateral epicondyle, the wrist drop will be also there because of the involvement of extensor carpi radialis longus. Whereas if it is below, maybe at the level of a radius or Monteggia fracture, most injured is pin. So in case of Monteggia, it will not be, we cannot say, because the most injured is actually pin structure. So here at the level of radius, if injury occurs, both the superficial radial nerve and also the pin will be gone. So finger drop and sensation will be gone. That's why I'm giving the mnemonic WIFs. This is weekly iron folic acid supplementation. Here it is used because at the level of the lateral epicondyle wrist drop, then when it comes below level of the radius, then F and S. Finger drop and sensory loss. No wrist drop. Then next, genu varum. If there is a genu varum, then you have to do lateral wedge osteotomy, that is closed, medial open. Terrible triad of elbow, related to radius, radial head fracture, related to ulna, coronoid process fracture, and posterior dislocation of elbow. This is the triad. Delirium, the treatment you are giving haloperidol, delirium tremens, lorazepam. Stupor and akinetic mutism, in both, patient is not moving and also not speaking. So the difference is, in case of stupor, it is not responding to the surrounding also. In akinetic mutism, patient will be responding to the surrounding, is conscious to the changes in the environment. That is what we mean. Okay, conscious. Then mostly peripheral center of TB unit, that is a designated microscopic center. Above that, TB district TB unit. In state level, it is IRL. Mosquito control in rural areas, we use sprays. Urban area, it's polluted containers, artificial collection, we have to use larvicide. Culex You cannot use indoor residual spray and all because QLX is actually outside. So measures should be done outside. Next is cardiac output is decreased in all the shock except in distributive shock also you can have neurogenic shock, everything decreased, but there is septic shock and anaphylactic shock where cardiac output is increased. Zones of burn injury in the middle, in the center, you have coagulative necrosis. Then you have vasoconstriction, stasis. Then you have hyperemia. You can use the mnemonic star, stasis, then first is okay, so you have C, co-star, coagulation, coagulative necrosis, star, stasis, and R is hyperemia. Then most common neuroendocrine tumor is gastrinoma. Charcot's triad, Murphy's triad, pain, fever, vomiting. Here there is no vomiting, pain, fever, and jaundice. Okay, so jaundice. Whereas in Raynaud's pendant, hypotension and altered sensorium will be there. Stay tuned for more updates, more knowledge.